a question every day that we ask our viewers, and our question yesterday was, how does your child show compassion? And we had lots of people write in, but one mom in particular that wrote in, and I said, I'm going to save answering this for Dr. Doreen tomorrow for the first question. She wrote in and said that her son was when he was first diagnosed, would try not to show any emotion, but they've done so much with him since he was 2, so much therapy on their part, and they're happy to say he's 5 now, and even though he might be able to make it through kindergarten, he laughs, cries, kisses, and hugs almost everyone now, and he will for sure show you anger, but that it might be getting a little bit out of hand and not sure what to do about calming it down or making sure it doesn't get out of control, and they were looking for some help with that with a 5-year-old.
Right. Well, I mean, and again, that's one of those situations that's would be important to know a little bit more detail, because we have different ways of showing anger, and from a behavioral perspective with this little boy, you would identify the specific behaviors that we're calling anger, and then you would identify the reason or the function of the behavior. That could be, you'd have to start by looking, does it happen in specific settings? Does it happen only when demands are placed? Does it happen when he wants to gain access to an object that he can't otherwise get? Those types of things. And then you would teach an appropriate replacement behavior. So let's say, for instance, the child wants an object and he has to wait. So in that case, it would be important to teach him waiting skills, which you could do in a multitude of different ways. You could have a timer, you could start with a very short period of time that he has to wait. But in most cases, when our children are expressing anger, it's in a physical manner. It's because they don't know how to express it verbally more appropriately. And that's true of not just our kids, but anyone who physically expresses anger is doing that just because they can't express anger in any other way, more appropriate way, let's say. So it would be an issue of determining when it happens, what's the reason for it, and teaching a more appropriate response.
Great. And what really struck me when you started talking about it is that I think as a parent, sometimes I just look at it and go anger, but you just described a whole rainbow of anger to me.
Oh, absolutely.
And that it's so different how you would address it.
Right. And, if you just come out of the spectrum for a second and just even think about ourselves, adults. Right? I mean, some people show anger very passively, so they will never express anger verbally or physically, but they will, let's say, set up situations for failure for other people. That's called passive-aggressive anger. Others will perhaps turn the anger inwards and express depression. So anger is just sort of an overall label, and you really have to, and this is one of the things that all behaviorists know, you have to identify the specific behavior and then determine when it's happening, why it's happening, and try to replace it with something that's will get the needs of the individual met. So, if the child's expressing anger, it's not that he just wants to express anger, it's he's angry or frustrated because of some reason.
Yeah.
And that's the thing you have to focus on, is how do I help my child express what it is he really wants so that he doesn't get angry.
Okay.
That's really the key to it.
It's a much more productive way of looking at it than just anger.
Right.
Very interesting. Now, the Asperger's Women's Association wrote in with a question. There are 2 parts to it. They said, please ask the doctor, what is attachment disorder, and isn't it separate comorbid disorder, not a thing of autism alone, and it's something that they're discussing right now.
Right.
They further added, too many comorbid disorders are being called autism when neurotypicals have the exact same disorder.
Absolutely. Attachment disorder is usually, actually, you talk about kids, for instance, who have neglect in their history or abuse in their history, and they will grow up without having the appropriate attachment to caretakers that you typically are supposed to develop, neurotypically. And so, like anything else, yes, it's a comorbid. It has nothing to do with autism, really. Absolutely.
So for those of us like myself, comorbid, what does that mean?
Comorbid basically means that it's a separate thing that's going on at the same time. So for instance, you could have autism, and then as a comorbid disorder, you could have obsessive compulsive disorder.
Okay.
It's just an example. Or depression, or anxiety, whatever, anything like that. Or a medical disorder could be comorbid as well. But in this case, the answer is yes, you're absolutely right. Attachment disorder is not part of the autism spectrum. It is an entirely separate thing that can develop with anyone, neurotypically developing people, anyone, and it really just has to do with a lack of the appropriate attachment to people who are close. Now, you know, with autism, historically, there was one of the criteria, or one of the symptom criteria was does not show attachment or something. That's not even in the last series of symptoms anymore. It's kind of now the one thing we're looking for as one of the symptoms in the current series, which is DSM-4 still, is, or 4R, is lack of empathy. That's the only one that really goes into, you know, the emotional aspects. I find that with the majority of our kids, there is no lack of empathy and there is no attachment issues as well. In fact, I find that the majority of our kids are extremely attached to a caretaker. They are a little different, I think, because they have the signals wrong. In other words, they don't know exactly when to go to the caretaker. They don't necessarily find hugs or the typical type of attachment behavior that, let's say, that a mom or a dad would give. Some of our kids don't necessarily find that rewarding, those types of things. But there's no question they have attachment. Yeah. You know, and sometimes you have children who are more engaged in some repetitive rote behavior or activity with a toy or something like that. But if those objects were out of their environment and out of their universe, they then would develop attachment. So I honestly don't think that there's a lack of emotional connection, let's say, with our kids necessarily. I really think that our kids just, due to the fact that they have a very hard time, I guess, understanding the environment and people as a whole. They have a difficult time understanding people. So they find different ways to engage themselves, and that resembles attachment disorder. Okay. But really, attachment disorder is something that, you know, like everything else, Shannon, in the I guess what we call the mental disorders or the psychiatric disorders. These are things that are mostly changeable. You know, it's not like when you have, let's say, anxiety about something, you're not going to have anxiety forever. It's treatable. And the same thing with attachment disorder. A lot of times our kids, let's say, who come from really difficult early backgrounds, the attachment issues can be worked through.
Okay. Yeah. Good to know. And thank you for that question to the Asperger Women's Association. It's a great question. Somebody wrote in on our private email on Facebook, and they said, "Hi, I want to ask if imagining so much and living in my own world, I always feel lonely. Does that mean that I might have Asperger's?"
Oh gosh, I'd have to say no, but I mean, I also don't want to necessarily give that sort of diagnostic opinion without knowing more about you. Right. Asperger's is not really about, I guess, suppose that anyone with any of the mental disorders, and especially on the autism spectrum, might have some sense of feeling lonely. And that, again, I think goes back to the prior question, which is, if you don't know really how to interact with other people, and if you don't gain enjoyment from social interaction, then you're going to feel kind of lonely. Having said that, you know, I have a lot of kids who, as they become, let's say, middle school or teenagers or so, they will find a friend who is also on, you know, has a diagnosis of Asperger's, let's say, and their interests are very much aligned, and then our child is no longer lonely. So, you know, I think feeling lonely or feeling isolated in your own universe or in your own world starts to approach depression more than more than the autism spectrum. So I think, and if you really seriously feel that this is, I guess, producing a significant amount of either discomfort for your private life or for your, if you're starting to isolate yourself and those types of things, I really do recommend that you see a professional, a psychologist or a psychiatrist, and seek help for this.
Yeah, I think sometimes we get so attached to labels.
Right.
But clearly, if you feel like you need help, you probably do.
Yeah, you probably should seek it out. A lot of people, I remember in the old days when we were learning about schizophrenia, I remember that a lot of the students and people that I knew, colleagues, would say, I hear voices in my head. Does that mean I have schizophrenia? When you start really looking at the detailed definition of any disorder, you start to wonder, oh my gosh, is that me or is that someone I know? And so, you need to be careful about analyzing yourself to that extent and actually do get some help.
Okay, good advice. On our live feature, somebody wanted to know, they said, "Hi, Dr. Doreen and Shannon, I feel like dreaming today about my son's future. He's mainstream third grader now. What do you imagine college will be like for our kids in the next decade? Are there colleges that you would recommend for our kids? Thanks for all you both do." It's an interesting thing to start thinking about.
A terrific question. It's a fabulous question, actually. There are some universities right now, and I don't know their names off the top of my head, but there are some universities that have specific programs for, let's say, very high-functioning individuals with autism or Aspergers. And I think that there have been modifications in a number of different ways. One is, so it's kind of like when your child goes to school and they make some modifications to the curriculum. I think some university programs have started to do that as well. So I hear now that there are programs that are more geared towards the types of interests that our kids have, for instance, like computers, technology, engineering, those types of things. Those departments in some universities are a little bit more open to our kids, because quite honestly, a lot of our kids have strengths in those areas and they excel in those areas because they have incredible memories and just very, can understand statistics and math and those types of things better. On the other hand, there's also universities now that I know, not just for this spectrum, but in general, there are universities that allow you to pick your own set of classes, so you can build your own curriculum basically based on your major. And I think that will be something that'll be useful to our kids. In the next 10 years, honestly, so much can change. On the one hand, we could gain a better understanding of what our kids go through, and so there will be modifications to university programs. On the other hand, I feel like the whole spectrum of autism is gradually melding with the normal, what we call typical development or neurotypical. And I'm not sure that if you look at any university class right now, I'm not sure that there isn't one or two individuals in each class that already have some symptoms of the autism spectrum, and they're functioning well. And as I see it, education as a whole is moving very much towards web-based, technology-based intervention, education. So like, majority of our people are now taking all their courses online. And I would imagine that probably that's something of interest to our kids. Like, our kids learn very, very well on computers, so I can see education as it moves in that direction being something that's great for our kids as well as they grow up.
It's actually kind of exciting for our kids.
It is, absolutely.
And I do think that more and more, because I used to teach college, and even it's been a while since I've been full-time on a college campus, but even then they were making accommodations, and I hear more and more about there was a college near where I live that has an entire program for individuals who are on the autism spectrum, wherever they are on the spectrum, that they have support that's tailored towards them on the college campus.
Absolutely.
So for one student, that might just be somebody helping them to do their EF, executive functions, or organizing, but for another student, it might mean having someone go to class with them.
Absolutely. I mean, that's fabulous. If that's happening, that's amazing.
It is amazing. And that's just the college that's close to me. I'm sure that there are those those kinds of things happening all over the place. It's very encouraging to me.
It's incredible. I mean, I can imagine over the next 10 years or so, Shannon, that the whole education system will be different.
Yeah.
And this is kind of a wonderful thing for our kids, our population, because things change and people become so much more accepting. And, it's like if you're on a campus, any university, and you see someone who is, let's say, hard of hearing or blind or something, you're not going to think twice about it. That's just they're mixed in. And I think that's also happening for our kids now, where it's not such a big stigma anymore, and we're just learning. People are learning how to acclimate and work well with our kids mixed in as well.
Yeah.
So I'm hoping that'll happen.
Very encouraging, very encouraging. We should take a break, but when we come back, we have a question that came in via email that somebody wants to know how you got into the field of autism.
Oh, great.
So we'll be asking her that question when we come back after these messages. Welcome back to Ask Dr. Doreen. We're here with Dr. Doreen Granpeesheh. She truly is an expert in the field of autism. It's such a thrill to always have her here on Wednesdays answering your questions. Somebody had emailed us and wanted to know, how did you get into the field of autism? And I was saying, this is always a fascinating thing to me.
Right.
When you were a little girl, did you sit there and say, I can't wait to grow up and change the world and the way the world looks at autism?
To be honest with you, I think a lot of my personal life sort of influenced where I am as well. So I'm originally from Iran. Mm-hmm. And when I came to the States, I was pretty young, and it was right at the beginning of the revolution in Iran, so there was a period of about a year and a half where I had no contact with my family, and I had 1 year of, or actually I had 2 years of high school to finish here when I came here, and the high school system here is easier than other parts of the world in some ways, so I ended up doing 11th and 12th in 1 year, so I graduated when I was 15. It was very early. So I don't even remember the process of applying to UCLA. I'm sure the high school people helped me with that, because I was too young to take it seriously, I guess. So I got into UCLA, and that was a kind of a intense experience, because it's such a large school, and you're in classes that are like 300-400 kids, and it's like, oh my God, how do I even get from one side of campus to the other? I was pretty lost the first year, and as I was just trying to kind of find my way around campus and understand what's going on, I was a pre-med. I knew that I always wanted to kind of become a doctor and help people. That was my thing, but it was really, really difficult, and I couldn't figure out things that were very basic once you are acclimated to a university that big. And I was, living alone as well, and it was just like, okay, I have to work because I can't really reach my parents, and I have to figure out how to make enough money. And of course, in those days, UCLA was pretty cheap, but still, I was like working 30 somewhat hours a week making donuts at the North Cafeteria at UCLA. And so pre-med was just kind of difficult, and after the first year, I will cop up to the fact that my grade point average in the first, I think, second quarter had gone down to 1.3, so I was like subject to dismissal. I was like, okay, I better get my act together here. So I switched majors and went to psychobiology, because it was just a little bit lighter version of a pre-med. Right. It still allowed me to go to medical school. And then what I did was, through that, I had started taking a lot of courses in psychology, obviously, and anyone knows who's a psych major that they're the most fun courses you could ever take. Psychology is so fabulous. And these are pre the days of behavior analysis actually having a formal word. It was just learning is what it was called. It was part of psychology, and it was called learning. Mm-hmm. So, I was really interested in it, and very early on, I think it was my maybe first year. Yeah, it was like the end of the first year. I had taken a series of courses with Professor Ivar Lovaas, who really is one of the most important names, I think, in the field of behavior analysis and also autism. Yeah. And Ivar had, at that time, already started this small program at UCLA called the Autism Project. And we had 6 or 7 kids there, and we were really mainly doing research. But we were also doing very, very intensive therapy with the kids. So as much as we knew back then, he was the person who took sort of the principles of operant conditioning, which is really the backbone of ABA, applied behavior analysis, and applied it to working with kids with autism. He was like, oh, you know, we can teach these kids whatever we want if we use these principles. So we had some children who were in the project, and it was all free because it was a university project, and therapists, so undergraduate students, were assigned to these cases, and you were trained, and then you would go to the homes and work with the child. And this was awesome. It was like the very first opportunity you had to do clinical work and actual work with a patient. And so I was a therapist in my first year, at the end of my first year, and I just loved it. And that's why I always talk about Corey, who was one of the first child I ever worked with. And he was just, first of all, he was fascinating because he was one of an identical pair. And he was such an incredibly sweet kid. Oh my gosh, he was such a sweet personality. And he had this really amazing memory. So, you know, I take him places, I take him to my house, other places, and so on. And he must have been about, I would say, like maybe 7 or 8 at that time. And he would remember things that no one would remember, like, oh, the roof used to be a different color, or stuff like, you know, really incredible visual memory. And so through my year of working with Corey and some of the other kids, who later on were part of the 1987 study that was published that showed, like, you know, half of these children actually recover. So it was just, I think it was my time with Corey that made me realize this isn't mental retardation by any means. And back then, of course, everybody thought, you know, 80% of people with autism have some form of mental retardation. It wasn't true. And I kept thinking, actually, these kids are just brilliant. Like, they're just sort of trapped, and they can't express how much they know. And it's so fascinating, and it's so interesting. So, of course, long story short, I stayed with Dr. Lovas for 12 years. You know, and even as a grad student, and managed and was the clinical supervisor and did research with EBAR and a whole bunch of other stuff for years, and you trained all the incoming students for many years. And then when I left and opened CARD, just before doing that for my license as a psychologist, I did a whole bunch of internships and practicum sites and so on in other areas of psychology, which you have to. And I just didn't find anything as rewarding, because the impact we had on the kids was tremendous. It was just, you could see the changes every single day. And so for me, it was very obvious that this is the field I need to be in. And it was a very easy transition in. But I guess if I was to credit a professor who changed my life, obviously it would be Professor Lovas. And if I was to credit, and he also was at that time very much like my dad, so he advised me a lot as well. But and if I was to credit an individual, it would be Corey, because he just kept me in the field and was so fascinating.
You got me misty. I love that. And I have to say that, you know, when the first time I saw ABA make a difference with a child, it was with my own child, and it was fascinating. But I am probably just as fascinated when I see changes in other children. To see what's possible is so inspiring. I can understand how it gets to be a little addictive, and I love to watch the passion with which you guys all talk about making a difference with an individual child. It's very exciting.
Well, I mean, I'm very, very blessed, because now I take credit, I suppose, for all the fantastic work that my therapists and supervisors do, right? So, like, I will do an intake for a patient, and I love doing intakes because that's still where I get to have contact. And then I will pick the right staff and the team and the supervisor, and I'll put them on the case, and then 3 months later I get to see the child again, and I'm just blown away. And that is so addicting to see that, and to see that, oh my God, this child was completely non-communicative, and now he's like, you know, telling me what he wants to do, where he wants to go. I mean, it's crazy, right?
It's just wonderful.
Yeah, and that, what could you wish for more than that, right? I mean, to go in and change the family's whole life that way. It's just, we're very blessed to be able to do that.
Well, we're all glad that you found your way to this
thank
and
you.
that it found you. And
Oh,
I have to ask, so when you came here to the United States, were you already fluent in English? Did you at least have that?
Yeah, I did. I was, when, my mom was actually a major in the army in Iran, and she also was nurse, and she took me to England. They sent us to England when I was 4.
Wow.
So I was in boarding schools in England for a while, and then also they moved, and then we were living in England.
Okay.
So I learned English when I was 4.
Okay.
It was my second language still, but I did learn it when I was very young. And so when I came here, English was pretty like it is now, except I had a different accent.
It's still overwhelming. A 15-year-old here in the United States, in Los Angeles, to fend for yourself.
Oh, it was
That's
crazy.
pretty amazing.
Oh, it was pretty crazy. I mean, I couldn't even get a driver's license, right? I was underage.
Wow.
So I had to bike back and forth from, we lived in Brentwood. I had roommates, and we all had an apartment, a bunch of us, and I would bike back and forth. I mean, a lot of times just because I couldn't afford to get gas, even if I had a car. So,
wow.
Yeah, it was a tough one.
Amazing. We had another question from somebody that says, I am 27 years old and I have Asperger's. I want to learn how to be better at social situations. I hear you guys talking a lot about things to do for kids. What is there for someone my age? We've talked about this a little bit before from other questions, but it bears repeating because there are a lot of individuals who are out there who have an awareness of the fact that they would like to be better at social skills.
Absolutely, absolutely. And I love that question, and I'm trying to think what would be the best way to help this person. I guess we have, over the years, we've listed, I think, a lot of different skills that go into social behavior. It's not just, when you look at our skills program online, there's one domain that's called social skills, and that's certain types of things that are absolutely social skills. I mean, it goes very much into group behavior versus individual behavior and all that, and teaches our kids how to interact differently when they're in the middle of a group, or other aspects of social conversation, proximity, all those types of things that might be of interest to this individual. But then beyond that, there's 2 other areas of the curriculum called executive functions and cognition. And I think for someone like this, it might be interesting to just take a look at the lessons in that area. And again, as I've promised the audience here, one of my projects this year is to subdivide and split up skills in multiple different ways so that people can access the different areas without having to access the whole thing. But I think you should probably look within the scope of those areas, because there's a lot of things there about, like, very, very subtle facial expressions, social behavior that involves inferences, intuitive types of behavior, knowing things from reading environmental cues rather than from direct observation. I mean, understanding other people's perspective, I think that is a big, big thing. If the more you're able to understand people's perspectives, the more social you can be, because you just see things from their perspective. So that would be a place to start. I have a true wish and dream this year to start a whole separate program for our Asperger's and extremely high functioning, teenagers and up. Because what I see with our teens who have some of the social deficits or problems just understanding interaction is, and this concerns me, is that they become very anxious or depressed or both. And before that happens, I really want to be able to just help our folks gain a better understanding. Honestly, everything I have learned from the experience, your experience, is just by talking to my older recovered kids, the ones that are in their 20s. And they have been able to educate me on what's hard and what's easy. And I think the ones that succeed, my kids who've recovered, the ones that just go through life and keep succeeding, are the ones that love themselves and accept themselves and are not either offended or embarrassed to be different, because, and that holds true for not just our kids, but anyone, right? I mean, if you go through life and you're afraid of who you are, or you're afraid that other people will see the real you and or see your weaknesses, then you're gonna be very protective and very isolated. Whereas if you go through life and you're not embarrassed about who you are, and you know that none of us are perfect and everybody is just who they are, then you get through those things. And I learned that from some of our kids, because Andy, he teaches me a lot of that stuff. Nick too, but I mean, Andy said to me, like, you just see it with Andy. He's always laughing. He's always happy. And he's always just like, this is what I did, and it was so funny. And he has no problem laughing at himself, just like, and it's so admirable. Like, and that's really true of any of us. If we can learn to do that, I think it gets you through every situation.
Absolutely.
You don't have to fit in. You just have to be comfortable with yourself.
Absolutely. And a sense of humor is an amazing thing to have. And that we certainly see that in the individuals that I've met here who recovered, the sense of humor about the world and themselves in the world. And
they're just pure-heartedness, and they're so polite, lovely and kind and sweet.
Kind and considerate, amazing people. Fabulous. Okay, I wanted to ask this, and you kind of brought it up when you were talking about, is it Corey that you were talking about, that being a twin? Somebody wants to know, are there cases of identical twins where one has autism and the other doesn't? Identical, though.
Yeah, there are, and it's very rare. So, as I mentioned with Corey and his brother, they were identical, and
the brother did not have autism?
No, he did not.
Wow,
right, and that's very, very rare. I don't know what the statistics are on it right now, but theoretically, it doesn't make a lot of sense, except for the fact that obviously we now know that there's an environmental insult, and who knows with two brothers, let's say, growing up, or two sisters, that who knows if one is exposed to an environmental factor that triggers the symptoms where the other isn't. The genetic component produces the susceptibility, but unless you're exposed to certain sort of triggers, then it's possible for you to go on without autism or any of the deficits.
Interesting. And we had an opportunity, because you had suggested that we interviewed Dr. Clara Lajeanche at the ARI conference, and she had just done a big twin study. And if you're interested in knowing more about that, if you Google her, Dr. Clara Lajeanche, and we have an interview that we show from time to time. Fascinating stuff she presented on it. It's really
and
very
also, of course, her data was in the original database was called AGRE, AGRE, and if you want to look that up, it is part of the NDAR, National Database for Autism Research.
Okay.
So there's a lot of information on the NDAR site as well.
Okay, cool. Very fascinating subject. I think we should take a break, and then we're going to come back. We have a question that people want to know your opinion of how autism is portrayed in movies and in television.
Okay, yeah.
So we'll come back and talk with Dr. Doreen Granpeesheh about that. Stick with us and keep your questions coming in. Welcome back to Ask Dr. Doreen. We're here with Dr. Doreen Granpeesheh, and as I mentioned before the break, we had somebody write in. They want to know your opinion of how autism is portrayed on TV and in films.
Yeah.
It's kind of the full gamut, right?
Yeah. I mean, I remember the first one that came out was Rain Man. Yeah. And that was a long time ago. We were very happy that it came out because it helped the world understand. So before that, nobody even knew what autism is. Yeah. And I think with Rain Man, and I think a lot of the other shows that come out, it's exaggerated, obviously. With Rain Man, they had, I think, various skills that he could count matches when they fell, or he could count cards. There's no question that there are some kids that have that ability. I have one child like that right now who's got way more abilities than that, and I test him. I mean, you can throw whatever. You could put a pack of marbles on the table or chips, and there's hundreds of them, and he will instantaneously tell you how many there are in each pile. I mean, wow. So he has that definitely. And there's other kids who I've had in the past where they would play games with you and say the logarithm of a number that you said. Or I had a kid, I remember, who used to be able to tell you the exact day that a date fell on. So you could say, what is April 10th in 2017 or 2025, and he would immediately tell you, and it was accurate. We had to draw it out for ourselves to figure it out. But it's incredibly rare to have those splinter skills. There are, on the other hand, a lot of children who I know who are very, very talented, and in one way or another. Jana doesn't like me to show off about her painting ability and drawing, but she has been an amazing painter, and I don't think she realizes what a crazy talent she has. Many of my kids over the years, we've just suggested what's their interest, and we've developed it, and it's one of my kids became a unbelievable pianist, and also other instruments, not just the piano. But so a lot of our kids are extremely talented in one way or another, but I think when you look at TV and so on, they try to play on that because it makes the whole disorder, I suppose, in some ways more fascinating to people, that it should, it's a child who's maybe nonverbal but then has this kind of skill. But the truth is, most of the time, our kids are either completely non-communicative or they are very communicative. And gradually, any child who comes in and can't communicate becomes the other child, so our kids improve and get better. I think there's a series on, I don't even know if it's on still right now, with, I saw the first one, I think it was Kiefer Sutherland, and he's supposed
Touch,
yes. So I think his son on the show is supposed to be autistic, and I don't know, it's like a non-verbal, I think the child's non-verbal, but then he does have some eye contact and communication with the dad, and that usually doesn't go hand in hand. So there's some things that are not really correct, but then other aspects of it are. And it's, I'm happy that media shows two sides of this. One is how incredibly intelligent and special our kids are. I'm always happy that the media will show that.
Yeah.
And the second thing is that it shows kind of how difficult the difficulties that our families go through.
Yeah.
And, how hard. I think it was, what was that other police series? I forget the name of it now. I loved it.
Oh, with Michael Chiklis. I can't think what the name of it
exactly.
is, too.
That was an
He ran
awesome.
2 children.
And that was really?
Yes.
Okay. And that was an awesome series, right?
Yeah.
And it showed
The Shield.
The Shield, that's right.
Yes.
And it showed how difficult it was for them to get the appropriate type of help and services. That sort of thing, of course, I think is important for everyone to know, because believe it or not, even right now when we get a new insurance bill or something that passes in the law, and you look on the comments, there are people still commenting and saying, why are we covering these disorders? This is all our tax money and all that sort of stuff. So that always upsets me, because people need to be a little bit more open-minded about the fact that this is everybody's problem.
Yeah.
And we need to be able to help our kids no matter what's going on with them.
Yeah, absolutely. I completely.
Sometimes the TV shows will go into that, and that's important,
Yeah,
I think.
it is too. I agree that it's not always accurate, but I do appreciate the awareness.
Absolutely.
I feel like Parenthood in particular, because it's a show that's about everything else under the sun, and there's one little storyline that has Asperger's in it, and it may not be completely accurate in all the different things that it does, but I appreciated that my girlfriends who didn't get what I was going through would call me and say, "Oh, is this happening with your child?" and ask me questions.
Amazing.
And it wasn't necessarily what was going on with my child, but it was an opening to an understanding.
That's amazing.
So even when they don't get it exactly right, I think it furthers the discussion, and that excites me.
The young actor who
Max
plays
Burkholder.
Right, and he's attended a lot of our Act Today events, and he's pretty involved with our organization.
He's lovely.
He is such a lovely kid.
And we've interviewed him before for the show, and he's just delightful. And he takes it so seriously.
He's such a terrific kid. I really like him.
And to see a young actor do that much research, he's constantly checking himself to see is he being accurate. It's just very sweet.
And he's just so well mannered.
Yes.
he's just such a polite and well-mannered, kudos to the parents.
Absolutely.
He's a great kid.
Absolutely, and a true professional. Now, we had the mom who wrote in, I believe it's the same mom with the mainstream third grade class. Hi, Dr. Doreen and Shannon. I'm feeling frustrated about the lack of intervention being used to help my child learn appropriate social skills in his mainstream third grade class.
Absolutely.
During each of my observations this school year, I've observed that he is not corrected when he acts inappropriately with his peers. His teachers don't intervene. He loves playing with his friends. His friends are patient with him as he goes on and on with TV talk. It is only the speech therapist, that can, is it only the speech therapist that can do this job in the public school? He's an only child, so other than the play dates we have at home, I can't help him with this delay. I have no concerns in any other developmental area. His immature speech is the greatest concern for me. Thank you both for everything that you're doing to support so many. Great question.
Very good question, and I have solutions, okay?
Great.
Yeah.
Great.
This is very accurate, like what this mom is writing. It's so true. I think it's a combination of things. One is that I think our teachers are just so busy. They're overwhelmed. They have very little training given to them, and they have very little time to keep taking all the different trainings that are out there as well. And you have to understand that they are managing classrooms of 20 to 30 kids, so it's very, very difficult for our teachers. Having said that, and it's not just your speech path. I think your speech path probably, or the school speech pathologist probably feels more well-trained, comfortable, competent in this area, and that's why he or she intervenes. And I think with our teachers and aides, A, they're very busy managing all the other kids, and B, they don't feel as prepared to interact and intervene, and they don't know exactly when to stop the child and how to stop them, what to tell them next, and so on. And perhaps not true for teachers, but I know that as a whole, we've worked a lot with training aides, for instance, and I know that sometimes the aides are actually afraid of our kids. They will avoid confronting our kids or stopping our kids because they don't want to start a huge, some sort of battle on the playground or something that's going to become difficult to manage. So my solutions are, and this, again, it sounds like your child's very high functioning, so you're focusing on the social skills stuff. Two things. One is, please do access skills, and I think you have a free month on skills anyway, so just get in there. Go straight to the social, executive functioning, and cognition curriculum areas. See how some of those things will benefit your child. And then go on our IBT website, which is Institute for Behavioral Training, IBT, and on there you'll find a massive series of trainings that we've done for teachers. And it specifically will say, when you go on the menu, you'll say initially professionals, and then you go further down and it'll say parents, teachers, whatever, and there's a whole series of separate modules that are very, very inexpensive. I think they're like $10, $12 each or something, and you can purchase those modules as gifts for your teachers, for the aides. You can get the school district to purchase the whole thing if you like. It's over 60 hours of training for teachers and aides, and it does go into how to interact in social situations, what are the appropriate things to do, and that's all procedures. And if your teachers and aides are honestly trained on those procedures and they're using skills, because skills, of course, is meant for teachers, professionals, parents, everyone. If they're using those two systems, I promise you, you will get a ton of interaction and intervention for your child, because they'll feel very comfortable with all the procedures, and they'll have a lot of content to teach. So that's the way to go.
Absolutely. And once they have the training, you could then have that goal written into the IEP so that everybody has to uphold it.
Absolutely, right? And that's another reason to be using skills, because you will be able to produce IEP goals once you have done that. And your IEP goals will go in, and it'll very specifically identify the teachers and aides responsible for this.
Absolutely, which is a great, great feature. So great advice, very practical to do that. I do want to say that it's a 15-day free trial on skills.
Okay.
So, but that is available to everybody, and unless it's changed, and I'll double check that, but 15-day free trial. So definitely www.skillsglobal.com. Go and check that out. You know, I'm a big fan, and I used it at our last IEP, brought in goals, and it changed everything.
Absolutely, and especially I think for the higher level, because a lot of people ask us about that. We've developed in that area probably more than anybody in the last 20 years, and those 3 curriculum areas are incredible. I mean, incredible. Like, you know, Shannon, they'll teach your child. It'll give you IEP goals and techniques and content for anything you can imagine, from, you know, telling jokes to telling lies. I mean, I always say that, but it's everything that you need in the social arena is in there.
Yeah, and you were mentioning to the 27-year-old earlier that, you know, you could just read through it, and I have to say, I think it's a benefit to everybody to read through it. When I read through the social language part of the curriculum, I learned things about what I was doing wrong that I had not thought through before. Really, really fascinating stuff. I think it's a benefit to everyone.
Right, and we're working very hard this year to make it a little bit more friendly to the non-professional audience as well.